Central Texas Hospital is making medical history. St. David's Round Rock Medical Center is the first hospital in the U.S. to treat a patient with a spinal tumor using a new FDA-approved carbon fiber implant. Joining me today to discuss it is Dr. Carl Lorayson, the Director of Neurosurgery at St. David's Round Rock Medical Center. Good morning to you.
Good morning.
So you brought a lot of props with us. Start off by telling us about this particular patient. Show us where the tumor was and what made this particularly difficult.
Sure. I have permission to talk about this patient, and she's a 58-year-old lady, Miss White, who in 2015 was diagnosed with a particular type of cancer. And she was tumor-free up until recently, and over the past year she's been developing this terrible pain down her leg. And with MRIs they were able to find this tumor located in a rather unique place, and it was inside one of the nerve roots, but in a very difficult location, and I can show you where that was. So it's right underneath this structure here called the facet joint. So to get to the tumor, I have to remove the facet joint and then remove the tumor, which is what I did. But because I've removed this joint, I've created an instability in the spine. So to reconstruct that, we typically would use these titanium implants. The problem with titanium is that after you've put it in, you cannot see the tumor. You can't follow the tumor with MRIs or CAT scans. And in addition, you cannot treat patients with radiation effectively because the radiation beams get reflected off the titanium or the metal. Therefore, what this company has come up with is this carbon fiber implant. So the carbon fiber implant allows us to visualize and obtain images, CAT scans, MRIs very effectively and very clearly, so we can see if the tumor is regrown. But in addition, you can now treat the tumor with radiation very effectively and optimally, so that there's no reflection of the radiation as though it would be when we're using titanium.
And how did you all, St. David's, become the first hospital in the U.S. to be able to use this new technology and this new, this new carbon fiber product? Yeah,
so I've done a bunch of FDA clinical trials, and as part of that, I was approached by the company that produces this and makes this particular implant, and asked if we would participate in this FDA clinical trial.
Do you feel like there is a lot of success that could be associated with this? Do you feel like this is going to be a good option?
I think this is an amazing option for patients. It's truly a game changer. We've never had anything like this. So for patients with cancers and patients with infections, where it's really important to be able to follow and follow patients with imaging studies and treatment options, it becomes a really important and I think game-changing option available to them.
Wow, and we're so happy to have it here in our area first.
I know, I'm very excited about it. So.
Wonderful. Thank you so much, Doctor, for joining us today. We appreciate it.
Thank you.
Up next.